welcome to our show, Health and Wellness, Myths versus Facts. I'm Gargi Rawat. Nutrition means getting the food and nourishment that you need for health and growth. Most of us do know what healthy eating is all about: less fried food, less sugar, and more vegetables and fruits. Now, when it comes to having good nutrition, however, too many of us don't know the full details of benefits of good nutrition and how to go about achieving it. Eating a nutritious, well-balanced diet offers one of the simplest, most effective ways of reducing your risk of heart disease, cancer, and other health problems. A good nutrition means eating a variety of foods, moderating your intake of certain foods and drinks, and controlling the amount of food and calories that you eat. Scrolling through social media, visiting popular websites exposes you to endless information about nutrition and health, and most of which is incorrect. Now, we have with us an expert panel of cardiologists who will guide us about the right nutrition for heart health. Thank you so much, doctors, for joining us. We're joined by Dr. Virag Mahorkar, cardiologist, Avanti Institute of Cardiology, and Dr. Kamaldeep Chawla, cardiologist, Sterling Hospital. Dr. Virag, first to you. Heart disease is the #1 killer worldwide. If you're worried about heart disease, one of the most important things you can do is to start eating a heart-healthy diet. So what foods should one always have on hand to promote a heart-healthy diet?
Yes, you are absolutely right. Absolutely right. The heart healthy diet is absolutely important to prevent heart disease. So basically, the first part of healthy diet is calorie restriction. That is, as we age, as our age increases, our BMR, that is basal metabolic rate, goes down. So our physical activity, physical level goes down. So accordingly, our calories should also, level of calories we eat should also go down. Because the current pandemic, which is going on of coronavirus, is there since 2 years. But the obesity epidemic is there since last few decades, and it is killing more and more number of people worldwide because of obesity-related chronic diseases. So first and foremost about a healthy heart diet is calorie restriction. So how do you decrease your calories? You decrease the portion size, you decrease the number of servings, and like if you are eating 3 chapatis, you can eat 2 chapatis. If you are eating 2 cups of rice, you can reduce it to 1 cup. So basically count how much calories you are eating daily and at least reduce it by 10-15%. Then coming to the components of a healthy heart healthy diet. There are many micronutrients like vitamins and minerals, but there are mainly three major macronutrients like carbohydrate, fats, and proteins. So and all these components are important for heart. It is not like you can eliminate one component completely. So coming to fats, first I would like to tell you about the bad fats which have to be avoided completely. So trans fats are the fats which should be avoided completely. They are basically partially hydrogenated oil. Anything which is fried commercially should be avoided. Like you should avoid fried chicken, you should avoid baked products like pastries, etc. And next is another bad fat that you should restrict is the saturated fat. It should be less than 10% of the total calorie requirement. The examples are ice cream, pastries, cookies. They should be limited because they contain a lot of saturated fat. Then what type of fat you should consume? So the good fats are monounsaturated fats and polyunsaturated fats. Examples of these are generally nuts. You can have almonds, cashews, peanuts, some vegetable oils like olive oil, peanut oil. They are good sources. Then there is polyunsaturated fats. These are the fats which body cannot produce. So example of these are walnuts, flax seeds, and chia seeds. These are the good fats that you can consume in good quantity. Then coming to carbohydrates also we can divide into good carbs and bad carbs. So the bad carbs are generally simple carbs like added table sugar, refined sugars, refined flour, refined wheat. These are simple carbs which cause the spike in insulin level. So their consumption should be limited. Then there are complex carbs which are the good carbs. For example, whole grain wheat, whole grain pasta, oatmeal, legumes. Lot of fruits and vegetables also have complex carbs which can be consumed in a good quantity, moderate quantity. Then coming lastly to the proteins. Proteins are the building blocks of our body. They are required for muscle building and various functions in the body. What are the good sources of protein? Generally the seafood like fish, they are supposed to be good and they have a high quality protein. They contain and less saturated fat. So seafood can be consumed in moderation. There is skinless chicken. Yeah.
All right, Dr. Chawla, now there are many articles on the internet that state unhealthy eating habits can lead to coronary artery disease. What is this exactly and what are the ways to manage it?
Yeah, hello Madam Gargi and hello viewers. Atherosclerosis or fat deposition in the blood vessels either of heart, brain, or peripheral extremities, kidneys, is a progressive phenomenon. This process in the blood vessels of the heart is called coronary artery disease. The management approach for coronary artery disease is multifactorial. Most important is to identify the underlying risk of the individual, of the population at large. For example, we as Southeast Asians, Indians, we are the world's capital for diabetes. We are almost at the tip of the pyramid when it comes to the incidence of the disease. That is, we are the harbingers of the disease on a genetic basis as well. So it's hypertension, diabetes mellitus, smoking, etc., physical inactivity. Regular health checkup is another aspect that is important in controlling the epidemic of coronary artery disease. Community-based awareness programs also are a part of this multifactorial approach. And then the medical line of treatment in form of blood thinner medications, pain-relieving molecules like anti-anginals, statins, that is targeting the cholesterol particularly. And then the procedures like angioplasty or bypass surgery are an important aspect of treatment of coronary artery disease.
All right, Dr. Virag, now high blood cholesterol levels are a risk factor for heart disease, and many in India have high cholesterol. How does blood cholesterol and dietary cholesterol, how is this related? What's the best way to reduce the amount of cholesterol one has in their diet?
Yes, so basically cholesterol, definitely high blood cholesterol is a risk factor for heart disease. There is no doubt about that. And cholesterol, but still cholesterol is very important for our own body. It is part of many hormones and it performs many important functions. It is a part of the cell wall. So there are basically two sources of cholesterol. The one is the dietary source and the other is the body itself produces some cholesterol in the liver. But body has also a tendency to tightly regulate the amount of cholesterol in the blood. So if you eat more cholesterol-rich food, the body produces less cholesterol, and if you eat less cholesterol food, then body produces more cholesterol. So the link between dietary cholesterol and blood cholesterol is weak. What I mean by this is that dietary cholesterol is less likely to influence your blood cholesterol levels. So recently, 2020 guidelines have removed, earlier the guidelines used to say that you should consume less than 300 milligram of cholesterol per day. But now they have removed that 300 milligram and they just mentioned that you have to eat a heart healthy diet which contains little less cholesterol. That's all. Having said that, I would also like to point out that still cholesterol consumption, high cholesterol food should be consumed in less amount, especially for patients who are at high risk. Those who have risk factors, those who have diabetes, those who have suffered from heart attack before, they should consume less cholesterol food. Then what are the ways to reduce cholesterol in your blood? So the best way to reduce cholesterol in your blood is weight loss. If you are overweight, you should at least lose 10 to 15% of your body weight. That will help to reduce the blood cholesterol level definitely. You should avoid alcohol. You should, if you are diabetic, you should control your blood sugar. That will help to check the blood cholesterol levels. Another thing is what are the diets which you can consume? You should avoid totally high fat diet like red meat, organ meat, and fried foods, etc. And you should consume more of fruits and vegetables, oatmeals, legumes, lentils, etc.
All right, Dr. Chawla, now why are blood thinners an important part of medication in all cardiac patients? If you could just explain that, and are there any foods that are, natural blood thinners that can decrease the risk of heart disease?
So there are two aspects to your question. It's a very good question. And I would like to bring a word of caution to our viewers that please do not confuse blood thinner foods and don't stop your medications that have been prescribed by your doctors. So blood thinners are an important aspect of treatment of coronary artery disease and cardiovascular diseases because we want the blood to be thin, which particularly these medications act as antiplatelets. They help in primary prevention of an event, and even after an event has occurred, they help in secondary prevention of further events. Diets like turmeric, they have a good amount of curcumin, which is and like a blood thinner molecule. Then there are salicylate type of foods which contain this molecule rich in salicylates. Salicylates is an active ingredient of a medicine called aspirin. I think majority of us have been exposed to this word aspirin. So these molecules are like ginger. They have a good amount of salicylic acid in them. Cayenne pepper is another food which is in the category of blood thinners. Garlic in particularly has anti-thrombotic properties. Then there are foods which are rich in vitamin E like almonds, sunflower oil, sunflower seeds, And by their active ingredient being vitamin E, they have some blood thinner properties. Cinnamon is a molecule which is being propagated, and you can think that the active ingredient is coumarin in this, and this coumarin is an active medicinal value and a chemical in medicines like warfarin, which have been traditionally used as blood thinners for post-valve replacement patients. So yes, there are foods which are having anti-thrombotic and anti-coagulant properties, like they are blood thinners in themselves. But again, I would like to bring this word of caution that please do not replace these foods with your medications.
All right, so that's an important point to make. While there may be some foods that can work as blood thinners, they cannot replace your medication, so don't do that. Thank you so much, doctors. We'll slip into a short break and be back with more questions for you. Welcome back. You're watching Health and Wellness, Myths versus Facts. We're talking about healthy diets and heart health. We're joined by our doctors. Now, Dr. Virag, we hear a lot about reducing or even eliminating our intake of carbohydrates. How many carbs should one eat, especially for people with cardiac ailments? How much carbohydrate intake is allowed for them?
Yes, obviously, carbohydrates are very much a part of a heart healthy diet. In fact, they should be consumed 45 to 60% of your total calorie intake. And carbohydrates are the main fuel source of your body. There are many fat diets coming like keto diet, which suggest to eliminate the carbohydrates completely. But this is in fact counterproductive. It will affect your metabolism very adversely. If you eliminate carbs completely from your diet, you will feel low. You will not have energy to do your daily activities. So the idea of eliminating carbohydrates or reducing them too low is definitely not a good idea. Then coming to the type of carbohydrates, so there are basically two types of carbohydrates. Simple carbohydrates, which are the refined sugars, as I have already said, they should be avoided or they should be consumed in very less amount. And then the complex carbohydrates, which are the good carbohydrates, like whole wheat grain, whole wheat pasta, oatmeal, legumes, lentils, they should be consumed in moderation. And most important part of complex carbohydrate is the fiber diet, which is more in flax seeds, chia seeds. It is recommended, some health organizations recommend that you should consume 25 to 30 grams of fibers daily. It will help not only preventing heart disease, but also it will reduce your GI symptoms. Then coming to how much carbohydrate should be consumed by a cardiac patient. So to answer this question, we have to know many other factors, like what are the risk factors for that patient, what is the age, what is the physical activity of that particular person. Like if that person is diabetic and if that person is overweight, he should definitely consume less than 45. He should consume 35 to 45% of carbohydrates from the total calorie intake. Then coming to the question of how to measure, actually it is very difficult to accurately measure the carbohydrate in your diet. You can have a general idea about what you are consuming. You can do this by increasing your knowledge about the various foods you are eating. You can start reading the food labels which you are purchasing from the supermarket. And the best way is to go for apps like MyFitnessPal. You enter the food which you are eating, and it will tell you how much approximately carbs are in that particular food. You can get an approximate idea.
All right, Dr. Kamaldeep, what is the role of cardiac rehabilitation after cardiac procedure? Does cardiac rehabilitation improve the quality of life in such patients? Is home-based rehabilitation possible? And what is the role of diet in cardiac rehabilitation?
A very important aspect of patient treatment, even after a simple procedure or a planned procedure or after an emergency procedure. So cardiac rehab usually begins in the hospital setup and continues at home, involving the patient, the family, and ultimately the community at large. Psychological well-being and positive attitude towards one's health, towards life as such, is an important aspect, and we have a team who looks after the patient into these aspects. Diet counseling, like what we have been discussing in this episode up till now, good or healthy foods, and to avoid junk or unhealthy foods. Exercise protocol are a very important aspect of a cardiac rehab. Avoid unaccustomed exercise, gradual build-up, then the patients enter into a maintenance phase and ultimately into the enhanced phase or the full potential phase. So never go on to a full potential phase without having undergone all these aspects of exercise training and protocols. The second question that you asked, yes, definitely there is improved quality of life because it increases patients' compliance towards treatment and also avoids the riskier outcomes in the future of patient's life. Home-based rehabilitation is very important, and that is the ultimate goal of a rehabilitation program. Though we begin it in the hospital setup, but ultimately the rehab goes on into the patient's life when patient leads his normal life and starts going to his occupational well-being. Diet, yes, healthy food, reduce carbs, reduce fats, adequate proteins are important. Nuts should be an important aspect of the dietary planning. Veggies or lean cuts of the mutton parts, the meat parts is very important. And also the focus on polyunsaturated fatty acids and monounsaturated fatty acids, and to avoid saturated fatty acids is important. So all these leads to an important overall well-being of the patient and a rehabilitation program.
All right. Well, speaking about healthy eating, Dr. Virag, this usually means for people organic food. People often choose organic fruits and vegetables to avoid pesticides and chemicals. Are organic foods more effective at promoting healthy hearts than non-organic food?
Yes, right. Currently, right now, there is a lot of hype around organic food, which is available in the market. So basically, organic food is the food which is grown on land, which is not infested with pesticides and fertilizers, at least 3 years prior to the harvest. So basically, this food is expensive and it is not available at all the places. And most importantly, there is no large-scale or pinpoint data to prove that organic food will prevent heart disease. Yes, definitely, there are some indirect evidences to support that organic food might be helpful to prevent heart disease. Like one of the studies has shown that tomatoes which were grown organically, they had higher quantity of flavonoids. Flavonoids are antioxidants, which are known to prevent heart disease. So, in fact, they were the quantity of flavonoid was almost doubling the organically grown tomatoes. So, there is a lot of indirect evidence to support that organic food can prevent not only heart disease but also cancers and strokes. But I think there are multiple other ways, cost-effective methods to prevent heart disease rather than organic food. So, in a nutshell, I would say that if it is available to you and if you can afford it, you can definitely have it because there are no side effects of it. In fact, it has more nutrition and it is less likely to be poisonous. But the hardcore data is not available that organic food will prevent heart disease. So there is no need to panic that if you cannot afford or take organic food.
All right, Dr. Kamaldeep, if you could just explain to us what is the difference between a cardiac arrest and a heart attack, and can both these incidences be preventable? What are the means to prevent them?
Yeah, it's a very important discussion, especially in the wake of the recent celebrity deaths that we saw in our country. Cardiac arrest is basically a pulseless patient with no cardiac activity, and this patient may have to be revived. If the patient survives, this is labeled as a sudden cardiac arrest survivor. And otherwise, if we lose the patient, this is called a sudden cardiac death. Myocardial infarction or heart attack is basically lack of blood supply to one or more coronary arteries, causing damage to the heart muscle. This manifests as anginal pain or shortness of breath, that is breathlessness, perspiration, sometimes with low blood pressure. The treatment of this patient, especially if received in golden hour, is crucial and will save patient's life. So the two aspects, that is sudden cardiac arrest, is basically losing the pulse of the patient, and no cardiac activity means there is nothing on the ECG. And a cardiac arrest versus a heart attack. Heart attack is basically lack of blood supply to a particular part of the heart. We can try to prevent these, but there is no holy grail available for this. It's an important aspect of discussion. Prevention includes awareness, identifying the risk factors. In many instances, family histories are positive, like there are certain cases in which they know that the family members have priorly suffered from these type of problems. Regular health checkup, heart checkup is an important aspect, especially after age of 40 years. Again, I would like to impress that avoid unaccustomed exercise. Moderation and gradual build-up is the key to a successful, healthy life.
All right, that's an important point to keep in mind, especially if you're starting out on an exercise regime. Thank you so much, doctors, for sparing your time and answering all those questions about the diet and healthy hearts. Thanks for everyone watching. Goodbye.